Reproductive justice was actually a phrase coined by a Black woman. And essentially what we mean is that we should include access, but then also care, opportunities. It should be available across the board, that Black women should not be denied the same standards of care. I think especially, call to mind some of the studies that you've mentioned about pain and how we address different medical conditions should not be a different standard of care for one group versus another. And so this actually, is across lots of different lines, across racial lines, across ethnic lines, across, primary language spoken, across geographic location, urban versus suburban versus rural, state to state. And so there are lots of different ways in which certain populations are not being afforded the same opportunities to live a healthy life. Unfortunately for us, the color of our skin is the biggest barrier to care. It is not race, it's racism. It's the ability to judge someone just based on how they look before they even open their mouth. And so this makes a big difference in not just our status and quality of life, but in treatment outcomes. Even when we receive the same kinds of treatments, unfortunately, African Americans in this country can have different outcomes. And, there's lots of research into why that is, but a lot of it is actually rooted in discrimination and bias. And so, those are the things that I'm trying to combat at a medical level, both in education of trainees, medical students, but also amongst providers as well, to make providers aware of the biases that we all have. There is no way that you live and exist in the United States of America and you don't have biases. It's as American as apple pie. Even as someone who's trained in the medical profession, if you're not aware of it, you can start to take on these biases as well against African American, Latina, Native American, homosexual, transsexual patients. And so we all have to be able to kind of check ourselves.